What is a rhinoplasty? So a rhinoplasty is otherwise known as a nose job, and any changes to the nose can be either functional or aesthetic. I do quite a bit of rhinoplasty for both purposes. There can be two ways of doing a rhinoplasty, either open or closed. And open means making a small incision in this part of the nose called the columella, and then every other incision is inside the nostrils where you can't see it. A closed rhinoplasty means all the incisions are inside the nostrils. You don't see anything on the outside. The difference is I often do an open rhinoplasty if I have to do significant tip work. So if I have to narrow the tip, raise the tip, bring the tip closer into the face. A closed rhinoplasty can often be done if I'm just narrowing or taking down a bump on the top. So who is a candidate for a rhinoplasty? Well, anyone who does not like the appearance of their nose is a candidate for an aesthetic rhinoplasty or a cosmetic rhinoplasty. And this can be from any parts of the nose, either the nostrils are too wide, the tip's too wide, the whole structure of the nose is too big or too small, there's a bump here, there's any number of reasons to have a cosmetic rhinoplasty. From a functional standpoint, it's usually for breathing, so you can have breathing issues through your nose because of allergies and swelling, or from structural issues. So either your septum, so the partition between the two sides of your nose is crooked, or you don't have enough support on the outside, meaning the outside of your nose, and that can be called nasal valve collapse. You can have the inside structures called the turbinates that are too big. So any number of those reasons can prompt someone to come in for a rhinoplasty, and often it's both together. So if you can't breathe out of your nose, but you also don't like a bump on top of your nose, that can be done at the same time. So what is the procedure and recovery like after rhinoplasty? Well, I do a rhinoplasty in the operating room, so under general anesthesia. You have a breathing tube going through your vocal cords to help you breathe during the procedure. Usually you have a bit of a sore throat because of that. But because you're asleep, you're in and out very quickly. You don't even remember the whole procedure. You go home the same day, so you don't require any kind of hospital stay. And that day you'll feel very stuffy, can't breathe through your nose. Even though I don't use packing on the inside of your nose, it'll be very swollen on the inside, and you'll have a cast on the outside for a week. Most people experience bruising under their eyes, and that lasts about a week depending on the person. And then you'll have some tiny stitches on the outside of your nose here. After you come in for the 1 week post-operative visit, I take off the cast and trim any stitches that I need to. I generally use a dissolving stitch on the outside, so I don't have to take those out. It tends to be really tender underneath here after surgery, so it's much better to have a dissolving stitch there. I don't have patients that really report a lot of pain, except for maybe the first day or two. During the procedure, I do longer acting nerve blocks, so I numb the nerves that give sensation to the nose, which are in the cheeks and on the outside. And I think that really prevents a lot of severe pain. So most people end up taking Tylenol for pain after day 1 or day 2. And that really helps with the feeling of being nauseated and tired, and because anytime you have to use narcotic pain medicine, it slows down the recovery.